Okay, so today we're diving into something quite specific, but really important, vitamin B12. We're going to look at why getting a simple blood test for it matters so much for your health, your energy, your nerves. And we're drawing on some great insights, particularly from a source detailing services like those in Corsett, UK.
Yeah, absolutely. Think of vitamin B12 like a key worker for your body. This test just measures how many of these workers, how much B12 is actually in your blood.
And what does it do exactly?
Well, two really big jobs. It helps make healthy red blood cells, the ones carrying oxygen around. And crucially, it keeps your nerves, your whole nervous system, kind of protected and running smoothly.
Right. And when it's low, the source mentions some pretty noticeable symptoms, not just feeling a bit off.
No, not at all. We're talking about serious tiredness, like deep fatigue that doesn't go away. And also strange feelings, tingling or pins and needles, often in your hands and feet. It can be quite alarming.
Okay, that sounds like something you'd want to catch early. So who should be particularly thinking about getting this checked?
Good question. There are a few groups that really stand out.
I'm guessing vegans and vegetarians are high on the list, since B12 is mostly in animal foods.
Exactly. That's the most well-known group. If you're cutting out meat, fish, dairy, you need to be mindful of B12.
But it's not just about diet, is it? I saw mention of older people too.
Yes, that's a really important point. As you get older, your stomach often makes less acid.
Okay.
And you actually need that stomach acid to sort of pull the B12 out of the food you eat.
So even if they eat B12-rich foods, they might not be absorbing it properly.
Precisely. Absorption becomes a real challenge for many older adults.
And then there's specific health conditions, right?
Mm-hmm. Things like Crohn's disease can interfere with absorption, or a condition called pernicious anemia, where the body mistakenly attacks the mechanism that helps you absorb B12.
And even some common medications.
Yes, certain drugs for diabetes or long-term acid reflux treatments can also make it harder for your body to get the B12 it needs.
So quite a few people might need to keep an eye on this. How easy is it to get tested, especially here in the UK?
It's actually pretty straightforward. You can always talk to your GP, go through the NHS. That's the standard route.
Okay.
But, the information we looked at, like the page mentioning services for areas like Corsett, highlights that private clinics are also an option.
Right. For maybe quicker access, or if you just want to get it checked proactively.
Exactly. Faster results sometimes mean you can start feeling better sooner if you do need treatment.
Which brings us to the benefits of finding out early. Why is it such a big deal?
It's huge. The source had this really telling example, someone feeling constantly exhausted, just drained.
Yeah.
They got tested, found their B12 was low, had some simple B12 injections, and the difference was described as a remarkable improvement. Energy back, thinking clearly again.
Wow, that's quite a turnaround.
It really is. And it underlines the other big benefit, avoiding serious long-term problems.
What kind of problems are we talking about if it's left untreated?
Well, the fatigue is bad enough, but untreated deficiency can lead to permanent nerve damage.
Permanent.
Yes, unfortunately. Affecting balance, mobility, it's serious stuff. And also severe anemia, where you don't have enough healthy red blood cells. Testing early stops it getting to that point.
And thinking about the NHS, catching this early must save money in the long run too.
Absolutely. Treating a simple deficiency with supplements or injections is, far less costly than managing lifelong nerve damage or related heart issues. The health insights we saw definitely point to that preventative value.
Okay, makes sense. So, quick recap. B12 is vital for energy and nerves. Lots of people might be at risk for low levels, not just vegans. And testing in the UK is accessible via NHS or private routes.
Spot on. Which leads to a final thought, something for you to consider. We know diet is important. Meat, fish, fortified foods definitely help. But if we know older people, for example, often struggle to absorb B12 even if they eat plenty of it, does just knowing your diet is good mean you're automatically okay? Can you just skip the test?
Yeah, that's the key question, isn't it? And based on what we've discussed, the answer seems to be no. Especially as you get older, or if you have certain health conditions, that absorption issue is the real wild card.
Exactly. Diet is one part, but absorption is the other. Only the test tells you if it's actually getting into your system where it's needed.
Food for thought, definitely. Something to keep in mind for your own health.
Stay informed, everyone, and take care.